Well, welcome everybody. Glad to have you all on for today's training session with Dr. Jeff Krall. Dr. Krall is an optometrist at the Krall Eye Clinic in Mitchell, South Dakota. And how I came across getting him to do a presentation for us today was one of his patients told me that he's doing some interesting things related to headaches and neck strain and neck pain, and thought it would be good information to provide to the chiropractic profession. So I contacted Dr. Krall, and he agreed to do a training session for us. So with that, I'll let you explain more about that and take it away, Dr. Krall.
Well, Jeff, thanks for inviting me to share what we've learned. And I love this quote, learn from the mistakes of others. You can't live long enough to make them all yourself. And I will tell you, I'm a testament to that for sure. I spent a lot of time in and out of neurology clinics, and what I thought I knew or understood when I got out of school is quite different than what it is today. But basically, I'm just a clinician like most all of you. But the last 15 years, I spent a lot of time studying headaches and why people suffer from those things. Had the privilege of being in multiple neurology clinics with some really brilliant people. And we've learned a lot, and I want to share that today. And we have uncovered, we believe, one of the causes of why some people suffer from headaches, and I'm going to go through that here today with you. Feel free along the way to ask any questions. But this is a survey that was taken amongst migraine patients back in 2014. They have one done in 15 and 16. I haven't updated it for a while, but the information has changed very little from when this questionnaire went out. And again, this was migraine patients that are suffering with chronic and debilitating headaches. And it's interesting, the survey said that most of these people that were surveyed had been living with headache for a long time. In fact, 81% of them said they had headaches for more than 10 years. It's interesting also that the cost of treating someone that has chronic migraines, and a chronic migraine, by the way, is those people that have a migraine headache or a similar headache at least 15 days per month for more than 3 months. And so these people are getting a bad headache, every other day, if not every day. And many of these people, they claim it costs, a lot of these migraine patients will spend up to $4,000 a year, according to the data, to treat and to care for their migraines. And that is loss of work, scans, a visit to the doctors, and medication. And the cost has actually become overwhelming to many of them, so much so that 48% of them have quit taking their medication due to the cost. And these people have tried a little bit of everything to try to get rid of their symptoms. This is not what they're currently doing, but this is what they have tried. And most of them, when they get a migraine or a bad headache, they'll try for symptom management. You get an episodic headache coming on, and they'll take an oral medication. And that was 94% of them. Just about everybody has tried that. And that would be a prescription medication, by the way. 87% of them have tried a preventive medication. These headaches keep coming. I'm going to take something to try to prevent them from happening. And right down to, I thought it was interesting, 54% of these people have had injectables. They've tried to, whether it's Botox or trigger point injections, they've done a lot of treatment up and down their neck and spine to try to get rid of these chronic headaches that has existed for them for many years. Very quickly after traditional medicine has not solved their problem, they've turned to alternative therapies, and everything from aromatherapy to vitamins and everything in between. You can see many chiropractors are on the list, and farther down from that are people that have tried glasses to try to make their symptoms go away. But still, no one's found the magic bullet to solve these people's symptoms. A really discouraging statistic to me is that which chronic migraine therapy is the most used. And most people found the best relief of anything from going and finding and sitting in a dark room. And I really gained a whole different perspective on people that suffer from headaches when I ended up dealing with many of these people that had chronic irretractable headaches. And they would tell me they miss many of their families' sporting events, and they'd miss a lot of their kids' activities. And they basically became a difficult person to live with. They knew that, but they were just living in such chronic pain. And of all the things that they tried, the most common thing that worked the best was going and living in a dark room. Not a great way to go through life. Other therapies after the dark room, and that was 90% of the time, they tried hot and cold packs. That seemed to help. Many people have tried diet, magnesium for whatever reason, massage, acupuncture. How they are currently treating their symptoms today when they look at the landscape of things that are used. Basically, still symptomatology of a chronic episodic headache is treated by a triptan type drug or some oral medication, prescription medication, to make their symptoms go away. Half of these people are on a prevent the headache from coming. And then we're still using a lot of over-the-counter, and 15% of the people, or actually 16, are actually using injectables to try to keep these headaches at bay, or to manage their lives when they have one. These treatments, though, the medication is come with a lot of side effects, and 58% of the people said, you know, I just stopped taking this stuff mainly because of cognitive challenges. And, you know, they just know they're not feeling themselves, they're not thinking clearly when they're taking a lot of these different medications to resolve their headaches. One of the main things that they notice in the lower right corner, you'll see, is rebound headaches. Many of these people notice that when they're on a multitude of these medications is that they had to continue to be on it. And I really believe I understand a portion, at least for the ones that we dealt with, why that is. And I'm going to touch a little bit more on that later. But they take a medication, make their headache go away, and they start rebounding back, and they get in this horrible cycle where they're on these drugs every day or every other day to just try to manage through their life and through their jobs and through their families' activities. These migraine treatments obviously have a significant side effect, and 76% of these people avoided their treatment or stopped because of the side effects due to these medications. In other words, they've helped them in one aspect, but they've created enough side effects that they don't necessarily want to or like to take them. And it's had a significant impact on their lives. One of the questions these researchers asked me to ask when I did the research in these neurology clinics was, how has this affected the quality of your life? And many of these people would have tears streaming down their face because they said it's completely, you know, ruined my life. I can't go to my kids' activities. These mothers would tell me how, you know, my kids just think mom always has a headache. You know, she hears them talking with their friends about mom always has a headache, and you know, it caused a divorce, you know, 9% of the time, and it had a dramatic effect on their impact to pay for their headache treatment because many of them lost their jobs. So obviously, people that suffer from headache, I really got a different perspective after being in these neurology clinics, hearing these stories from these real people that were suffering with this problem. The other problem that arose many times with these headache patients that I was unaware of is that 65% of them are on depression medications. And you know what I think what happens is they get these chronic headaches, or they just can't seem to find the solution to make them go away. So they go back to their doctor and say, listen, doc, I can't live like this anymore. You know, this isn't working. You need to find something to help me. And the doctor says, well, you sound to me you're depressed. And I think the patient says, well, yeah, I'm depressed. You know, you'd be depressed too if you had a headache every day. And so these people end up on medication to try to help them manage through the depression that they have because of their headaches. And then another thing I heard that I didn't really understand until I lived with these people is that they're very anxious. And you know, they leave the house and they think, oh my goodness, did I take my medication? Am I going to have a bad headache where I got to leave the party? Or, you know, am I going to have to walk out of the movie again? Or am I have to tell my husband, we got to go home. I'm getting a terrible headache. I got to get out of here. I'm getting sick. So they live in chronic pain, they live with anxiety, and they live with depression. Again, 3 horrible things they have to deal with because of headaches. And people that have headaches have more than just pain in their head. They have sensitivity to light, cognitive problems, sensory sounds bother them. Many of them are fatigued. They have a nauseous feeling, along with the neck pain. Continue to do it, but part of their problem.
Seems to be on it. What do I have to do?
Current treatment options are medication-wise or antidepressants to help, obviously, with the headaches. We use beta blockers. We thought at one time that migraines was a blood pressure problem, and beta blockers have helped some people. We're using anti-seizure medications. Topamax is one that's in my mind kind of a tough drug. People have a hard time remembering their name when they're on the medication. I remember a school teacher telling me I was teaching my class of the alphabet to a bunch of kindergartens, and I got to letter G and I couldn't hardly go on. I had to start over because I couldn't even remember the alphabet. And so she said it was a very challenging thing for me. Botox, or botulism toxin as we know it as, has been effective to help some people. Generally, when they give Botox, it's a series of 31 injections, both frontal and temporal around the eyes and back in the neck, and then they adjust up to 39 trigger point shots depending on where the symptomatology ends up for these patients. And there's been people who have had some relief from this. They also they need these injections quite frequent. In fact, they do these 4 times a year, and it's relatively expensive. One of the staples of headache treatment for migraines is triptans. They're a class of drug. We know them as Emitrex and Maxalt, and they're pretty good episodic drugs. But you need to take them early on the beginning of the headache. And if you don't take them right away, they're not nearly as effective. The other problem is many drug companies don't give you very many of these. In fact, I think generally you get a package with your insurance and it's $9 a month. So many of these people that have these horrible headaches, they kind of hoard them. They don't know whether they should take one, and what happens if I really need them. And boy, you know, I used them all up last month, and the last half of the month I could hardly function. And then we all know we have an opioid epidemic in the country. Narcotics, we don't like to use those if we don't need to. Many of these people are on anti-nauseous medications because they have this sick, woozy feeling, and then we still use a good old prednisone, corticosteroids to help some of these people. Alternative options, non-medical, or sleep, hydration, exercise, and all these people that I met and talked with, they all knew what their triggers were, and it was really intriguing. I probably have 500 plus people on tape before and after we treated them, and every one of them knew their triggers, and on many of them, after we got done and we solved some of these people's headache problems, I asked them what their triggers were, and they said it wasn't anything like what I thought it was. And that was really an enlightening discovery for myself, I think, and these neurologists that we dealt with. Many people are also using a massage therapy, a chiropractic treatment, neurostimulators, and acupuncture. So a lot of options that are used, and none of them seem to be getting at necessarily the root cause. So again, chronic migraines are those that have 15 headaches a month. There are a lot of people that are having less than that, but a lot of headaches, and a lot of people that just have a lot of tension type headaches. But it's affecting a lot of people. 70% of all migraine sufferers are women. And it's a very, very big problem. 45 million Americans get chronic headaches or recurrent headaches. That's a lot. Is by the study that was done, not by us, but by the Migraine Through America, that only 31% of the people are satisfied with the current treatment. They're not happy with what their options are, nor are they getting much relief from their treatment. And the best solution found is being in a dark room. That's more helpful than prescription, non-prescription, or other therapies. I think that's unacceptable. And then we also have 40% of these sufferers have been to the ER in the past year. So not only the feel that I've got to go into the ER, I can't take this pain anymore, but the cost for them to do that. And we lose 157 million workdays each year because of people that suffer from headaches. So it's quite a problem that I was somewhat, blind to before I had the chance to go see and spend some time in these neurology clinics. So according to the Vision Council, my profession, of the American Academy of Optometry, 65% of Americans are experiencing some type of digital eye strain when they're working on a computer or visual strain. 9 out of 10 people use a digital device more than 2 hours each day. And I know from personal experiences and from my time working in this clinic and seeing people that is very true. These digital devices are causing a lot of problems. Interestingly, the #1 symptom that we find as optometrists when we poll our own patients is they have neck, shoulder, and back pain. And we've always equated this to the ergonomics, how you're holding your hands and where you're sitting and how you have the keyboard in the terminal position. But I want you to know that after I spend enough time with enough people that have had these symptoms, I believe that it's not the ergonomics that's causing a lot of these problems. They also complain of eye strain and headaches. So I had the privilege of working with a very brilliant neurologist by the name of Dr. Carol Nelson, and I want to give you a little color on how this all came about. She called me one day and she said, "How'd you make Heather's headaches go away?" Heather was a patient that had irretractable chronic headaches, and she had been on every medication and she'd done every traditional treatment and non-traditional treatment that she could find to make her symptoms go away, but Heather didn't get any better, and Dr. Nelson did her very best to manage her symptoms. And we found out that she had something called migraines, or what we coined the term migraines. And we were able to make the majority of her symptoms go away, and she went back and told her neurologist. So her neurologist, Dr. Nelson, called me up and said, "What did you do?" And I explained to her, and she said, "That's, it's interesting." And through a series of more patients like that, we ended up having a meeting at the Minnehaha Country Club in Sioux Falls with a what I would call a brilliant ophthalmologist by the name of Vance Thompson, her, and a gentleman by the name of Andy Corley, the past president of B&L Surgical. And we talked through these headache patients, and she was very willing to allow us to come into her clinic and see if we could help some of her patients. And she will tell you that she was very skeptical. She thought it was a very, very small subset of people that we'd be able to help, and that most of these people's headaches weren't in the front where their eyes are. Most of these people, their headaches were in the back of their head and down in their neck. And she went and explained to her 6 neurology partners that she was going to do this, and they were also skeptical, but they were willing also to have us come in and see if we could make a difference in some of these people's life. So we launched a pilot study, and it started out to be we were going to see a few patients and see what happened, and it actually morphed into quite a large study. And it actually prompted all these neurologists collectively to say, there's really something here. We've helped so many people that we want to offer this to our headache patients. And they opened a headache center in Sioux Falls, South Dakota. And here's the study demographics. This is just a little insight of what we learned from the study. Is we ended up having 179 participants in the study, and the inclusion criteria was basically refractory inline chronic headache patients. The majority of them were female, but these are people that had tried many traditional therapies and many non-traditional therapies, and none of them had very good success of making their symptoms go away. The average age was 39 approximate years old, and the follow-up time was 88 days. We also followed these people up to a year later. And by the data, we had a very high p-value. We feel like the results and what we learned from the study was very meaningful. In the headache world, they use a measuring device called the HIT-6, and it's a questionnaire that a patient fills out to judge the quality of their life and how it's affecting their life. It's a lifestyle index. And it uses a point value. Anytime you can change 6 points one way or another, you've made a significant change in their lifestyle. You've taken them from having headaches and difficult time functioning to life to somebody that's getting along fairly well. And again, the study was good enough that it bolstered a partnership with these neurologists to start a headache center. I think one of the main reasons that maybe happened was the results of the study, but we videotaped every patient before and after the treatment. And if I had the privilege of showing you these uncut videos, they're pretty telling of how these people responded to this type of therapy. And if you look here on the right, you can see these are the HIT-6 scores. The left one would be before we treated them, and the right one would be after. And when you break that 60, the number of 60 on the HIT-6, you actually start really moving the needle to resolve their symptoms. All these people that we saw had a score over 60. And if you look at the bottom, I put what that is. That these headaches are having a severe impact on your life. You're experiencing debilitating pain and other symptoms. So these people were really, not happy with what the cards had handed them in life. We put them in a lens called a neural lens, and after wearing neural lenses, how have your headaches responded? And 13% of them said they're gone. I mean, they're gone. I don't have headaches anymore. 41% said they decreased substantially. It means I had headaches every day or every other day, and now I'm getting 2 or 3 a month. And we had 28 that said they decreased slightly, 17 unchanged, and we had some people that said, boy, when I wear these glasses, my headaches got worse, and I'm not doing this. And this is on 179 patients. I think more telling, or maybe what's really intriguing or more interesting, is we polled these people 90 days later, and we said, you know, okay, you think your headaches are better, but what has really changed in your medication use? Are you using as much medication? And 8% of them were completely off their medication. Another 12% said I have a 90% reduction, and 80% had 11% reduction. So if you think about this, 30% of the people said 80% of the medications I don't take anymore. That's a huge drop. In fact, 53% of them were off more than 50% of their medications. And all we did is alter the way their eyes work together. We asked them, you know, okay, would you recommend this treatment to your friends and family? In other words, did it work? And 95% of the people said yes. Now, that's really, you have to take that with a grain of salt because it was free. We gave these people a quality pair of lenses that helped them see better and they thought make them feel better. And of course, they're going to tell you that you're sure. I tell my friends about this. It was really good. So what was discovered and what got coined was the term eye grains. Many of these people that we were able to help didn't have migraines. We think they had eye grains. And they put a definition to that, and they said it was a lack of synchronization between your visual and neurological systems, often resulting in headaches and migraine-type symptoms. So now a little bit of the nuts and bolts systems. That's where I've been, what's really going on. And if you remember back to the neurology days, you all have 12 cranial nerves that control everything from your toes, your hearts, your hands, your eyes. It's the cranial nerves obviously give us all of our sensory function. The second, third, fourth, and sixth nerves control basically your eye alignment, and with the exception of your second optic nerve, your second cranial nerve being your optic nerve gives you your vision. Your fifth cranial nerve is really the culprit and why these people are symptomatic, and your fifth cranial nerve is your trigeminal nerve. And it's basically the proprioceptive feedback, the position sense of where your eyes are located in space. Your eighth cranial nerve is your vestibular ocular reflexes. All of you see my fingers pointing up, and now you see them pointing sideways, right? If you tilt your head, my hands are still pointing up. So the receptors in your neck that give you position sense are linked with your retina, so that when you tilt your head, if you turn your head 10 degrees to the right, the image on your retina moves 10 degrees to the left, and your brain says offset these two numbers so the world doesn't swim when I turn my head. That's what your vestibular ocular reflexes do. And then these people had your 11th nerve, your accessory nerve does the movement of your head. So if you think about it, 67% of your cranial nerves are directly responsible for controlling how your eyes and your head move about where you go. The four systems that we look at as optometrists that are really pertinent to this discussion are your central, your peripheral vision, your accommodative, your focusing system, and your vestibular ocular reflexes that I just kind of went over or touched on. And the two most important things that I want you to understand is your central vision and your peripheral vision. And we as optometrists, we relate to them as slow movements. When you read, your eyes go slowly across something, or think of an ant crawling across a floor that you're watching move. And quick movements called saccades, where we go from one location to the next. And by the way, I'm half Italian, so I talk with my hands. I hope that's okay. It might help explain what's going on here. If in front of you, if you look at the word simultaneously in your screen, I think you can all see that word in the middle on the first row. I want you to all put your eyes in the last letter Y, and don't take your eyes off it. Look right at that Y. And as you're focusing right on that I, you know there's more letters in the world, but you can't see that there's an I until you move your eyes towards that I, right? And as I tell my patients when I'm trying to explain this, I say, you can see the individual hairs of this eyebrow or this one, but you can't see them both at the same time. In other words, you have central vision that looks at details, and you have peripheral vision that your brain uses to see things in the periphery to move your eyes to get to the next target. They go to different places in your head. They're coordinated together, but they actually use different systems to get from one place to the other. And the culprit, again, to these people that are having problems is the neurological feedback from the position sense of our eyes. And our extraocular muscles give this feedback of where they're located, not through our optic nerve that we see with, not through the muscles themselves, the third, fourth, or sixth nerve. They get this position feedback through your trigeminal nerve. So even though these two systems are viewed anatomically different, they are used together to coordinate the movement of our eyes from left to right, up and down, wherever we need to go. So how I explain it to my patients, I say, listen, you have two eyes, your right eye and your left eye, and your brain says, take a picture with each of these eyes and put them together. You know, you basically can't stop that. You'll get sick and nauseous and you'll get headaches long before you see double, because if you saw two, you don't know which door to walk through to get out of the room. And so your eyes have to be coordinated all the time. You can decide to look at a new target, but you can't decide most of the time if you're going to see double when you move your eyes to that target. So here's the way it works. When you're looking at my nose, out of the corner of your eye, you see my hand. And when you decide to look at my hand, your brain actually sends two signals. The first one is to move your eyes. The second one is to move your head. So if I was sitting next to one of you today, I see Dr. Pickert's on the line. If I was sitting next to Craig, I'd talk to you, and I'd talk to Craig, and I'd talk to you, and I'd go from one target to the other. And you'd see my eyes move about 90%, and you'd see my head just flip back and forth. If your peripheral vision has miscalculated where your eyes need to go, your eyes aren't going like this, followed by your head movements. Your eyes are going like this, or they're not getting to the same place at the same time. If they're not arriving to the same place, your eyes actually location. And one eye is telling your head to move, let's say 10 degrees, if that's how far the target is away. And the other eye is telling your neck to move 9.9 degrees or whatever the real number is. And there's either a rogue signal or an extra signal that's being sent by the position of your eyes through your trigeminal nerve. And this constant stimulation starts these people to have headaches. And they generally start in the front if you listen to your patients. And they radiate through their head to the back of their head. Trigeminal nerve, being the culprit, originates around your eyes in your frontal area. And if you follow the pathway neurologically, it ends up and terminates in the lower base of the skull in your back of your head. And your trigeminal nerve was basically, we thought originally, put in your sinuses to detect pains. If you get a sinus infection, your trigeminal nerve gets stimulated to tell you you have a problem and you better do something before it gets too close to your brain and kills you. Interestingly enough, it also gives you the sensitivity that your eyes are dry. And here's a schematic again of what your trigeminal nerve looks like and where it goes. It starts in it has 3 divisions, by the way. It's got an ophthalmic division around your eyes, a maxillary, and a mandibular division. And I've had many people that we videotaped in these neurology clinics that complained of jaw pain, and much of their jaw pain went away. And when I heard this the first time, I thought, well, this is, they must be confusing something else that was going on. But after you heard this a number of times, you started connecting the dots that obviously the trigeminal nerve has 3 divisions, and obviously for whatever reason they perceive the pain being from a different location than where it really is. That's also the indication many of these patients complain that my eyes feel dry or they burn, especially when I do near work, because the sensitivity of your cornea has the same feedback loop that uses your trigeminal nerve. And the best example I can give my patients is that if an elderly person comes in your office and they have a terrible pain down the left arm and they're short on breath, it's very likely they're having a heart attack, right? We all know that people that have a heart attack have a pain down their left arm. Well, there's nothing wrong with their left arm. It's basically a distribution of learned pain. It's a spreading. The same nerves that are attached to your heart are attached to your left arm. So with this understanding that how your brain and your eyes coordinate the images, we developed a device called SightSync. And I'll tell you just quickly how it works so you know what we're doing on my end here. It's a device in which you look into, and it has a septum in the middle, so the right eye sees one target and the left eye sees another target. And then the right eye has a set of moving planets in the periphery and that are moving, because your peripheral vision detects motion much better than it detects stationary objects. And the left eye, there's a set of planets that are moving. And your brain sees these 2 similar moving targets and it puts it together. It fuses the 2 instantly, so they just see one set of targets, but each of the eyes getting a different image. And then what we do is we introduce a central spot. And if you look on the screen, you'll see the spot jumping. And what we do is we see, does your central vision line up with how your peripheral vision works? And once we find how your peripheral vision and your central vision coordinate the movements of your eyes together, we make a specialized lens called NeuroLens. And this would be something more to explain to the optometrist, but what it is a specialized lens that changes how your eyes line up at distance compared to how they line up at near. So when I look across the room, you see my eyes and they look fairly parallel to you. And when I look up close, you see my eyes that will turn in. And your eye alignment at near, because of your convergence and your focusing system, is different than your eye alignment far away. And until you're willing to give your patients something that accounts for the difference in your alignment at both places, we've left most of these patients on our side symptomatic. And so we developed a lens after we measured the problem to put them in it. And so after we did this technology was employed to, I think there's 25 optometrists in the country now that have this technology, have a SightSync and have NeuroLens in their clinics. And so the majority of these are in California, where this company iBrain Medical has been formed. And after these people paid for these lenses, it's basically a very much data-driven company. They want to know if what we're doing is making any difference, right? And if it's not making any difference, we're not going to do what we're doing, because ultimately the company will fail. But that's not what has happened. What has happened after checking what has happened with these patients that were fit with these NeuroLenses and other doctors having the SightSync technology in a normal clinic is there was a 93% response to wearing these lenses. And that's the same type of symptoms they had before. Their headaches, their neck strain, and the dry eyes are basically gone. The next $1 million question that you want to ask these people is, after you paid for this treatment, would you be willing to recommend this to your friends and family? These lenses cost between $650 and $750 a pair. And that may sound very expensive, but if it's what's causing their problem, if it's really the root cause, it'll be the most cost-effective thing anyone's ever done to make their symptoms go away. And after they paid this kind of money, over 80%, 82% of these people said yes. I would pay for it again, or I would tell my friends to go get a pair of these lenses. So from what we've learned and what I've discovered and helped be part of is that migraine headaches, or headaches related to how your central and your peripheral vision work together, do not respond very well to medication. In fact, I'm going to go one step further. I believe that medication of these type of patients is maybe contributing to their headaches getting more frequent. And I explain it to my patients this way: you have two eyes and you see one of me, and the coordination of your two eyes is your trigeminal nerve. And when your two eyes are working together, it stimulates that nerve and you get a headache. And your first thought is, this hurts, I want to take something to get rid of my headache, so I'm going to take a medication to numb that down. But you know what your brain says? It says, I've got to see one door to get out of this room, I'm just going to turn up the volume. And so we see these people's headaches escalate till they go back in and need something else to help with their problem. The data also reveals the majority of these people have neck and tension in their neck and upper shoulders. And obviously you see a lot of these people, and you've done a lot of good to help resolve their problems, but many times these symptoms continue to resurface themselves. And I believe it's because their eyes are continuing to stimulate how their head is positioned with their eyes, and they continue to be symptomatic. Until we all address what the root cause is, I think these people are going to continue to be symptomatic. So people that have migraine symptoms all have the same types of symptoms, and you'll know them when you see your clinic if you know what to look for. And we actually use a lifestyle index form, and we can send you a copy of that if you want, but it asks basically these same questions that you're looking at. And we ask them, do you have headaches? And when you see them, they'll tell you they have some headaches up here, but most all their headaches end up in the back of their head. And in fact, we've been fairly successful from the data that I showed you previously of making many of these headaches go away. And when their headaches come back, very rarely do they get a headache first. They start getting a stiff neck before their headache shows up. And these headaches and stiff neck are usually worse when using digital devices like being on a computer. They also complain of glare. If they pass a car at night, they tell the headlights will bother them. Sometimes they have a sandy feeling, and sometimes they get a dizzy feeling. And it's not a dizziness like the room spinning. It's a dizziness like if I turn my head quickly, I kind of have to catch myself before I move. And I believe there's a reason for that that's fairly easy to explain. The proprioceptive feedback of your body, the coordination of your body in space, knows where your body's located by what it feels. In other words, if I shut my eyes, there's a class of cells that give me position sense of my hand, and I know how far to move it to touch my nose, right? Your eyes have the same receptors, but your eyes don't know where they are by what they feel. They only know by where they're at by what they see. So if you take your hand and cover one eye, and take your index finger and very lightly just pushing your eyelid back and forth, just a little bit on your lid, you'll see the computer terminal move in front of you. So if the two eyes are not getting to the same place at the same time, one eye is seeing the next object in one location, and the other eye is seeing another location, they get a little bit of swim in the world. And when their head and their eyes start getting more tight, they start getting nauseous. And these people that have migraines start getting this nauseous feeling in their head, and they also have this feeling of being dizzy. And we had the same amount of results of this dizzy sensation going away as we have people resolving their headaches by treating how their eyes are coordinating together. All of us, for these headache patients, is a coordinated approach. And I believe you chiropractors have a lot to offer with that, with your understanding of health and nutrition and understanding of how to manipulate these people to make their systems work better together. I have migraine patients as workers in my office. I have gals that work for me that have migraines, and I put them in neural lenses, and I've had fairly good results of making their symptoms go away. But quite often, they'll come to me and they said, you know, Dr. Jeff, I'm getting this, oh man, I'm stiff, my neck is out, I got this terrible problem. And I say, listen, I've done what I can do to help with your migraines, with your eye alignment. You know, you've done something to throw you over the edge. You need to go get that taken care of. And many of you have seen some of you chiropractors in my community and resolve their issues. And so it doesn't mean what I do is going to make their symptoms go away forever. It's one of the pieces in the puzzle to help them. Neurology has played a great role. I have a tremendous respect for the people at Neurology Associates and Dr. Carol Nelson. And they don't want to give people medications they don't need to either. But you have to understand, these people come in fairly desperate that haven't had all the relief that they want from alternative medications and others, and they're doing their part of what they can do to try to make them function in life. And they don't want to give them any more medications than they have to, and they're open to eye green treatments and whatever works to try to make their symptoms better. The last kind of clinical pearl I want to share with you here, and we'll be done, is what I tell my patients, what is ultimately making these problems work for the patients, whether they have neural lenses on or not. Is their head position, is it very important? And I found this out by listening to these patients over the last 10 years and documenting many of these things. If they're watching TV, in other words, they can't watch TV in a dark room, when your pupils get large, your peripheral vision gets more difficult. And when you think of peripheral vision, that's word to word. You don't have to be jumping, 50 degrees in one direction and the other. When you go from word to word to word on the screen, your brain is calculating each one of those moves. And so I tell my patients, you can't sit like this and watch TV. You don't have to be in front of it, but you have to be lined up straight with what you're looking at. You can't look at your iPhone or your iPad laying in bed. People get at the side, and these young girls, guys are going through their phone, flipping through them at night, and they wake up with a headache, and they wake up with a stiff neck. And I know from listening to them and treating them that this is one of the things that's causing a problem. And then they want to, when they're working on their computer, they want to look down at it about 10 degrees. That's the best place. Your fourth nerve starts to kick in, and just visually and muscularly of your eyes, you want to be looking downward about 10 degrees when you're on a computer terminal, and that will help. So with that being said, I'm open to any questions. We don't have all the answers. We've learned a lot from the studies we've done, and I'm glad that I've just been able to help. So if there's any questions, I'll be glad to answer anything that I can.
Thanks, Jeff. And I'm just going to unmute.
Are you going to walk it over to your house?
Yeah.
Hello.
All right. Does anybody have any questions for Dr. Krall?
This is Dr. Pickard. I don't have a question so much as a comment. Obviously, Dr. Jeff and his dad, he won't tell you this, but his dad is actually the one that figured me out. Actually, he will tell you that. He has admitted it several times. But anyways, at the time, and I never correlated it until the presentation right now, but back at the time, I started getting my dry eyes and headaches about the time I was studying for Part 4 of the National Board exams. And I also, at the time, developed TMJ. And I always attributed it to caffeine because I was drinking 2 pots of coffee a day while studying for that part of the exam. But in retrospect, I actually had that TMJ and dry eyes about 2 to 3 years into practice until Dr. Chuck Kroll, Jeff's dad, is the one that finally figured out what the heck was going on. So that was kind of fascinating when I saw his schematic there of the trigeminal nerve and how jaw pain could go along all those symptoms. And they went away about the same time. My TMJ went away about the same time my dry eyes did.
Yeah, Craig had, he'd tell you that his eyes would burn and feel dry and gritty, and he came in. I remember one day I fit him, and he came back and he said, my eyes are on fire. You know, you got to do something to help with this problem. And you know, I wasn't paying as much attention as I should have, or didn't understand it nearly to the level that we do today. And obviously my father pulled him over and said, I'll solve this problem, put him in some neural lens. In that story, and just another.
I'll be going back to work though.
All righty. Any other questions?
Anybody else have any questions or comments for Dr. Kroll?
No.
John, do you have any questions?
Talking about.
By
Anybody?
the way, I'm an open book. If any of you ever have any reason to get a hold of me, I'll have Jeff circulate my personal cell phone. You guys can call me day, night. If there's someone that we can help, whether it's some of your staff or some of your people, I'll be glad to do what I can do to try to change people's lives along the way. And that's really been the most fun of anything, is just seeing how many people we can help along the way. So, Jeff, again, thank you so much for what you've done, and glad to help share what we've learned over the past.
Well, you're welcome, and thank you for spending the time with us and providing this information. And yeah, we'll send out a recording of the training session, and we'll include Dr. Kroll's contact information. So, thanks everybody.
Jeff.
Yes.
Yeah.
I couldn't find the mute.
No.
Okay. Talk to you later. Thank you.
Yeah. Have a great day. See you guys.
All right.
Okay. Thanks, Jeff.
All right. We'll see you.
Yep. You have a good one.
Yep.